So here we go. What we're going to plan to do is just to release the scar tissue bands underneath these rolling acne scars. And by using the 18 gauge no-core needle, we go in a fanning motion and just release the bands on each side. Once each area is treated, you can advance the needle under the skin just to reach other areas. This minimizes the number of insertion points and the number of times that you have to traumatize the epidermis. Of course, there's some oozing associated with this, so after each procedure, we like to put steady pressure on the area for hemostasis to minimize swelling and bruising. But in general, we focus on one area and then move to the next. And larger areas can be done simultaneously just by advancing the needle under the skin. It's important to keep the skin taut during this procedure. That minimizes any trauma to underlying structures. Do you have any pain, dear?
Not at all. I just hear rubbing motions. Sounds like a scraping, but there's no pain. It's like zero, totally zero.
So prior to this, the patient was treated with topical anesthetic for about 20 minutes, and then local anesthesia was used to help ensure that she's comfortable during the entire procedure. Once the area is treated, we change position in order to triangulate. And again, the skin is treated from a different angle, just to ensure all bands are severed the whole time while holding pressure on the area. Some people will do 2 points of insertion, other people will do 3 points to ensure that the area is treated effectively. But by positioning your hands, you can ensure that you're putting pressure and hemostasis on the area as you're treating and subcising the tissue. Some people will use a suction device, like a microdermabrasion device, to pull up the skin. Additionally, after subcision, this can create additional swelling and trauma under the skin, so it should be used only in select cases. Some people will also do filler after they do subcision for much deeper scars. It really depends on the depth of the scar being treated. Often the body's own wound healing response will come in and create a slight clot under the skin, which elevates the skin from the depression and helps alleviate the scar. Obviously, being careful around the temple areas just for vascularity is important. Keep pulling this in. But as long as you say superficial in general, shouldn't cause too much trauma to the underlying tissue. Once the area is treated, we apply steady pressure for about 5 to 10 minutes before dressing the area. And that's how you do subcision.